regular physical activity and increased cardiorespiratory fitness have a profound effect in improving a wide range of different health outcomes. These include decreased chronic disease, reduced severity of infectious disease, including COVID-19, decreased incidence of cardiovascular disease events, increased survival, and reduced mortality. Additionally, increased physical activity and/or cardiorespiratory fitness prior to hospitalization favor more positive short-term outcomes, and collectively, higher habitual levels of physical activity and cardiorespiratory fitness are associated with lower healthcare costs. My name is Isaac Wiedig. I'm a fourth-year doctoral student in the Department of Kinesiology and Integrative Physiology at Michigan Technological University, and I'm a co-author along with Dr. Barry Franklin, Dr. Robert Salas, Dr. Carl Levy, and Dr. Stephen Elmer on a paper titled Physical Activity and Cardiorespiratory Fitness as Modulators of Health Outcomes, a compelling research-based case presented to the medical community, which will appear in the Mayo Clinic Proceedings. Despite evidence pointing to the role of physical activity and structured exercise in maintaining health, treating disease, and reducing healthcare costs, it remains an underappreciated modifiable behavior by the medical community and the public at large. The purpose of this paper was to perform a literature review of evidence supporting or refuting the potential health benefits of both physical activity and cardiorespiratory fitness, with a specific focus on literature published in the last decade to provide new insights to this body of evidence. Our main findings were that regular physical activity and increased cardiorespiratory fitness are associated with increased survival, decreased cardiovascular disease events, reduced chronic disease, reduced cardiovascular and all-cause mortality, and lower healthcare costs. Figure 5 helps to illustrate the robust relationship between cardiorespiratory fitness and health outcomes. Briefly, cardiorespiratory fitness is the capacity of the cardiovascular and respiratory systems to deliver oxygen to working muscle during maximal exercise. Typically, this value is expressed as metabolic equivalence, or METs, which represents an individual's maximal oxygen consumption relative to a resting state. Every 1 MET increase in cardiorespiratory fitness confers approximately a 20% reduction in risk of all-cause mortality, incidence of heart failure, risk of chronic kidney disease, and risk of atrial fibrillation. Furthermore, a 1 MET increase in cardiorespiratory fitness is associated with an annual reduction of approximately $1,600 in healthcare costs per person. In addition to reducing chronic disease and mortality, increased physical activity and cardiorespiratory fitness prior to hospitalization for acute coronary syndrome and elective or emergent surgery favor more positive short-term outcomes, including reduced mortality and a lower incidence of recurrent events following discharge. And this evidence highlights the protective effects of exercise preconditioning in those individuals experiencing such events. Evidence also indicates that the effects of regular physical activity and/or increased cardiorespiratory fitness are independent and additive to those of cardioprotective pharmacotherapies, demonstrating that physical activity can be a strong standalone and adjunct therapy. In our paper, we outline specific physical activity and exercise training thresholds for improving cardiorespiratory fitness and achieving substantial health benefits. Our findings help to further support the beneficial health effects and prognostic significance of regular physical activity and increased cardiorespiratory fitness. Based on these data, it's imperative that clinicians include assessment of physical activity as a vital sign of health and work with interdisciplinary partners to prescribe and facilitate physical activity as a robust form of medicine. For patients, physical activity presents an affordable and accessible healthcare intervention with the potential to be highly effective in improving a wide range of health outcomes. And in turn, this can lead to substantial healthcare savings for patients while improving their overall quality of life. We hope that our work presented in the Mayo Clinic Proceedings provides a compelling evidence-based case to the medical community and supplies physical activity and exercise intensity thresholds that can be easily adopted and prescribed for optimizing health outcomes.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.